Now, 6 months after the Taliban took control in Afghanistan, the health system there is collapsing. A measles outbreak has infected tens of thousands of people and killed more than 150 this January alone. Measles, though, not the only health threat facing young children in particular. And to talk more about the health crises, our health editor, Julia Seeger, is with me. And Julia, let's start with measles if we can. This is a highly contagious viral disease.
That's right, indeed. It's a disease that triggers, as you know, red patches all over the body, and it does indeed affect mainly children in 97% of cases. Now, it can also trigger many complications such as encephalitis, acute diarrhea, blindness, and severe respiratory infections. But the main problem is that it actually suppresses the immune system, and it can also create what we call immunological amnesia, meaning that the infection can wipe out completely the immune system memory of other illnesses. Now, according to the WHO, these measles cases have been recorded all over the country in all provinces. There's been 60,000 cases in 2021. And if you focus solely on January 2022, there's been more than 35,000 suspected cases and more than 150 deaths. And those are actually conservative numbers.
And the best protection, Julia, is high levels of vaccination.
Absolutely. Measles is one of the most contagious human viruses there is, but it can be completely avoided thanks to the measles vaccine. According to the WHO, it helped to save about 30 million lives in the last 20 years. Now, that only works if you have a very important vaccination coverage, 95% vaccination coverage, which is clearly a goal that's completely out of reach in Afghanistan today. Now, there was recently in December a vaccination campaign that enabled about 1.5 million children to actually get the jab. There's also been this huge distribution of vitamin A, which helps reduce the mortality of measles, but clearly it is not enough to mitigate the epidemic.
Yeah, it's not just the vaccines for measles where the health system is struggling in Afghanistan. I mean, the whole system is in dire straits, isn't it?
Absolutely. There aren't enough doctors. There's a shortage of medicine, but there's also not enough hospitals that are open to the public because it's only those hospitals that benefit from external financial help that are open today. Now, as you know, for the last 2 decades, the Afghan health system has almost been entirely financed by international aid. And when the Taliban came back to power in August 2021, sanctions were imposed, and the United States also decided to freeze Afghanistan's central bank's assets abroad. So that's approximately $7 billion. Now, just a few days ago, President Biden announced through an executive order that he was about to split that envelope with $3.5 billion that would be allocated to humanitarian aid in Afghanistan, and the other half that would be to compensate victims of the 9/11 attacks. Now, of course, this is a very controversial decision because some activists on the ground are saying that this money actually belongs to Afghans and that they're in dire need of it. Now, Washington is responding that this is actually a way to bypass the Taliban and make sure that this money actually gets to Afghan people.
Now, a part of this humanitarian tragedy that we're talking about, Julia, is malnutrition, and that is now affecting 1 in 2 people in the country.
That's right, Nadia, and I think this is actually the main point here. According to a UN report that was published in early January, hunger is becoming a huge problem. 23 million Afghans are facing hunger today, so that means that's more than 1 Afghan out of 2. There are 60 million children that are not eating enough every day. Now, acute malnutrition is a problem in of itself, but it's also another problem because it does also reduce the immune system. So it makes them more fragile in front of other pathogens, but let's say, for instance, waterborne diseases, which is also a problem in Afghanistan today.
This all happening, Julia, against the backdrop of the COVID-19 pandemic as well.
Exactly. And here, the situation is so difficult in Afghanistan that actually COVID-19 is almost taking a back seat here. There are only 5 hospitals that are taking care of COVID-19 patients in the country. There's only 1 in the capital, in Kabul. There aren't enough doctors, I said it. There's a shortage of medicine, but in some cases, they can't even heat the premises. Now, according to doctors, the situation is getting worse, but we actually have no data on COVID-19 simply because they don't have the diagnostic test. Now, according to the WHO, Afghanistan should be receiving diagnostic tests by the end of February.
Julia Seeger, thanks very much indeed for your reporting.
Thank you, Nadia.